Hello, my name is Shayna DeVoe. I am recording my final presentation for pathophysiology. This presentation is on Addison's disease. I'm going to be going over what Addison's disease is, how it is classified, what it does to your body, how it affects your body, and also how it can be diagnosed and treated. Okay, so first of all, what is Addison's disease? Addison's disease was first discovered by Thomas Addison, a British physician in the 1800s. It is basically the total and complete destruction of your adrenal glands, and most importantly, of your adrenal cortex. While we are concerned, of course, with all of the effects and all of the destruction of the glands, the lack or destruction of the adrenal cortex has the most devastating effects by resulting in a diminished cortisol and aldosterone level. This disease is classified as an autoimmune disease. It is also known as primary adrenal insufficiency, and it is a rare but life-threatening condition. So the adrenal glands sit on top of your kidneys at sort of the apex of your kidneys. They kind of wrap that top portion, and they are responsible, the pair of them, as they are bilateral, they're responsible for secreting dozens of hormones, which affect many different parts of the body. So the structure of the gland, again, it sits at the apex, and it's somewhat of a pyramid structure. It has a surrounding capsule, followed by the next layer, the adrenal cortex, which makes up a good portion, most of the mass of the gland. And then inferior to that, you have the adrenal medulla. Now, the adrenal medulla can also be destroyed by Addison's disease. And while that is, a devastating effect to the body, it's not as devastating as the destruction of the adrenal cortex. The medulla secretes epinephrine and norepinephrine, and while these are very important to your body, they are also secreted by other parts of your body. The adrenal cortex, however, secretes over 30 hormones alone. We have groups of hormones such as glucocorticoids, which are influencers of your metabolism and aid in the conversion of food to energy. They also play a role in the inflammatory and the stress response. We have the androgens, which are groups of sex hormones that actually affect both men and women. They affect things like muscle mass and libido and a general sense of well-being. And we also have the mineral corticoids, which play a role in blood pressure regulation, as well as sodium and potassium balance. Again, while we care about the destruction of the glands, and while all these hormones are important, the key ones that we are sort of focused on when it comes to this disease is actually cortisol and aldosterone, and those are produced by the cortex, the adrenal cortex. All right, so etiology and syndrome. So there are several things that can cause Addison's disease, and this is classified as an adrenal insufficiency syndrome. And prior to 1950 in this country, the largest or most common cause of Addison's was actually tuberculosis. Since then, and sort of the medical efforts to control tuberculosis, the most common cause of this disease is actually as an autoimmune disorder. However, it can also, in rare cases, be caused by things like cancer, fungal infections, viruses, a whole variety of causes. And in other parts of the world where tuberculosis is not under control and is still quite common, it can still be a common cause of Addison's. So there are two kinds of Addison's disease. We have primary and secondary. Primary is a result of the adrenal gland being damaged due to destruction, such as the autoimmune response, or some other kind of primary response affecting the gland itself. Secondary Addison's is the result of a secondary influencing factor. For example, the pituitary gland secretes a hormone, adrenocorticotropic hormone, ACTH, and that helps to stimulate the adrenal glands. If there is something wrong with the pituitary gland and it's not producing that hormone, the adrenal glands are not going to function correctly. So it's still going to result in Addison's, but it's going to be secondary Addison's because we need to treat the pituitary malfunction, not the gland malfunction. All right, pathogenesis. So this disease is interesting because your glands actually have the ability to store a large amount of hormones, which is great, for times when the body is maybe stressed and needs to, use those reserves. The problem is the adrenal glands can actually undergo a significant amount of destruction before you really have symptoms that are, severe enough to warrant a trip to the doctor or to warrant investigation of your glands. Many patients go months without seeing a doctor for these symptoms. And when they do, the clinical manifestations of that gradual onset include things like orthostatic hypotension with, maybe some fainting episodes. We've got decreased potassium output. We could have hyponatremia, as I mentioned, that some of the hormones play a role in regulating your sodium and potassium balance. Fever, anorexia, vomiting, weight loss, nausea, weakness, and a sort of a hallmark sign are the bluish-black colors that can start to take over gums and oral membrane. Now, as I mentioned, these manifestations can go sort of unnoticed, or you might have some of them, but not all of them, for months. And unfortunately, if it goes too far and the glands are destroyed, or even just one gland destroyed enough, usually around 90%, you could enter the complication of Addisonian crisis. So this is a complication of the disease. These manifestations are sort of just more severe manifestations than the ones I just went over. And you usually enter Addisonian crisis when you've lost around 90% of your gland, just not functioning correctly. Sometimes a stressor like an illness or an injury, like a car accident, will, launch the gradual manifestations into this crisis mode. This crisis is characterized by severe weakness, confusion, severe abdominal pain, vomiting, diarrhea, pain in your lower back or legs, and also a reduced consciousness or delirium. Again, this is a sort of final stage, a complication of Addison disease, which may have been progressing over months. So, how do we diagnose Addison's? So, primary test we would go to is a blood test, and we want to be looking at sodium levels, potassium levels, and of course cortisol and adrenocorticotropic hormones. We would also want to look for antibodies to Addison's. Another test we could do is the ACTH stimulation test. So this would involve an injection of ACTH. Remember, that's the hormone that I mentioned helps to stimulate the adrenal glands into functioning mode. So we would want to measure your cortisol levels of your blood before that injection and after to see if, if the ACTH is stimulating the gland. So if you had that injection and your cortisol levels are, looking better, they're where they need to be, we might be able to determine that it's a pituitary gland problem. Maybe the pituitary gland isn't producing enough of the stimulating hormone. This would be secondary Addison's. However, if we do that injection and the cortisol levels just aren't improving and we're still seeing problems, it's possible or likely that the problem is primary and it's with the gland itself. Other tests that we could do involve imaging tests. We could do a CT scan of your abdomen to see if the size of your gland is actually, going down, if it's decreasing, if it's being destroyed. And if we suspect secondary, we could also, secondary Addison's, we could also do an MRI of the pituitary gland and see what might be going on there. And a final test that we could do is an insulin-induced hypoglycemia test. So kind of similar to the other injection test I mentioned, we would take cortisol and glucose levels prior to the insulin injection and following it. And this would help us, again, determine what exactly is going on. All right, differential diagnosis. I think a perfect example of a differential diagnosis is tuberculosis. Again, prior to 1950, this was the most common cause of Addison's, so it could definitely have been a differential diagnosis, and still in many parts of the world today, tuberculosis is a serious problem and causing Addison's, so it's still something for physicians to take into consideration when they are treating a patient with the clinical manifestations of Addison's. All right, and just really quickly, I want to go over some treatments. So Addison's, destruction of your glands, unfortunately, this is a lifetime commitment. You have to commit to treating this, every day. So that involves hormone replacement therapy. It involves daily monitoring of your hormone levels. You're going to need regular meal and exercise schedule. And in terms of your hormones, your hormone replacement therapy, because the role that the glands play in the stress response, you're going to want to adjust your hormone therapies in times of stressful times during your life. And then additionally, you're just going to want to really carefully monitor any infections and make sure you get proper medical treatment, because you are going to have sort of a compromised immune system and a compromised inflammatory response. All right, so that's the end of my presentation. Thank you so much for listening. I really appreciate it.